Welcome to our video of 5 top tips to avoid side effects on TRT. I'm Sam and this is Mike.
Hi.
So keep watching. Okay, so 5 top tips on TRT to reduce side effects. That's really hard to say. Okay, so number 1, do you want to start off?
Yeah, I would say keep a log or a journal. I mean, don't be OCD about it, but it's kind of good, like in my phone, in my diary, I would keep track of, what medication I was on or am on, and how I felt particularly on that day. And then I can look back and see if there was any correlation. Sometimes there's never correlation. You think because you did something or had an intervention, that's what caused it. But other times, if you kept a track and said, okay, I was doing this treatment from the doctor in this particular way, and I felt this way, I felt great, I felt amazing. You've got that to go back to in case anything ends up changing. So,
yeah.
Or if you had side effects as a result, you would say, right, within this period, I had these side effects, I didn't like it, and we want to avoid that next time.
Yeah, I think that, I think Nelson Virgil had like an app or something you can get.
Yeah, I've got it on my phone.
Have you?
Yeah, it always reminds me every day, but I never fill it out.
Okay, so yeah, it reminds you of to put in, and so you either use something like that or you can use it yourself. But you can do. I think a lot of guys go the main categories that they worry about. So it could be libido, energy, mood, sleep, erection, something like that. And just either have a scoring thing or just write whether they were good, bad, or and I think the main thing is not to analyze it that day. Just plot it. Remember in the other videos we mentioned, it's a journey, right? So just get them in there, and then when you get to the end of the month, just have a look back. And if you've had days and bad periods, that's fine. But it'll be basically just helping you to keep an eye on how things have changed generally.
Absolutely.
Right? So that'd be number 1.
Yep.
Yeah?
Yeah. I'd say the second one is don't change your dose, at least not until the doctor talks with you and you've actually had a proper blood test, because the worst thing you can do is second guess, where am I? How am I feeling? How's my testosterone? Is it in me? Is it not? Where's my estrogen? Where's my DHT? It's just going to drive you mad. So the best thing to do is stay on course, let the doctor help you, and don't try to second guess what the doctor's doing. Would you agree?
Yeah, so do I say this because I actually didn't do this. So I got to a point where I was like, oh, things aren't working, anxious brain's working. I was like, I think I'm going to take a little bit more. And I was like, what's that? What's a little bit of oil, in a syringe? Yeah. So I started taking a bit more than I was prescribed, thinking that it would accelerate the process. Started not feeling very good after about 6 weeks. So it turns out actually I made myself, go a bit too high. And at that point, obviously I was, speaking to the doctor, and I was like, well, stupidly thinking I wanted to go up again. I was like, I think I need more, naively. And obviously then when the bloods came back and things were actually quite high, and they were like, okay, well, we need to adjust dose downwards. I was obviously like, no, I've been taking too much. And that actually made me feel worse. And that's where, again, it is a journey on TRT. You want to gradually build up. Everyone's unique, and the doctor started you at one point. So don't change the dose is what I've learned from my mistakes. And that's a good bit of advice.
I've seen people where, the doctor may start them sometimes even on a small dose every week or every 5 days. And they'll say, oh, but I feel like it drops off at the 5th day or the 7th day, or or any variation in between. But if the ones that stay the course, and rather than 6 weeks later, but 6 months later, if they stayed the course, they're like, I don't feel that drop off anymore, and nothing changed. They stayed with it. That's important to just follow with what the doctor says and don't change your dose unless blood tests occur and you get a blood test sooner. If things aren't right, and then the doctor reviews it, and he'll make that course adjustment, obviously with your input, because it's very patient-centric. But at the end of the day, this is why you have the professional helping manage your care. And
I think that's it. Don't change the dose. So guys that have gone, right, well, what I do on the first time I inject or I apply cream or something like that is I'm going to take extra. I'm going to kickstart the process. And actually, guys have then had a negative experience a bit further on because things are sort of changing hormonally. Don't change the dose. Second one. Number 3.
Get your blood tests done. Try to get them done on time. And you can have more than just the ones at the allotted times. especially if you're worried or curious or if you didn't do it properly. So get your blood tests done, and get your blood tests done preferably on the trough. The doctor needs to put it into context to make sure you're not getting too much or too little, so that your treatment program goes swimmingly.
So that's before your next dose. As close as you can to your next dose is the term trough. So get your blood test done. You should be nagged to do them anyway. But if you want extra ones, if you're feeling anxious, that is the stuff where you get the evidence alongside your symptoms, and that's what gets given to the doctor, right? So when you speak to the doctor, you give them your symptoms, you look at your bloods, and then they make a decision from there. So really, don't change the dose is the number 2, but that happens when blood tests are done, checked, symptoms are looked at, and then it's changed accordingly. Yeah. So get blood tests. Speak to your provider. If you want to do extra blood tests, that's usually an option. So you should get small ones in between, just for your own peace of mind. I did. I was more anxious about it, so I did that. So that's number 3.
Number 4 is wait for the doctor to make those adjustments, course corrections, if you will. And I think you'll be in good shape. So don't try to second guess it. Obviously, communicate your symptoms, how you're feeling. You can speak to, it's through our service, medical case manager, but it's always the doctor in charge of your care and your treatment.
So speak to the doctor, basically.
So speak to your doctor.
If you need to get hold of the doctor to have a chat, or you want to relay a message to the doctor so they can get back to you, those are the things you need to do. It's very easy for someone to think, I'm not feeling good, or I've got a certain anxiety about an experience. What I'll do is I'll go onto a forum. I will look at what someone else is, have I got too high estrogen, classic one, or is my estrogen too low? And then you get someone on there going, you need to take this, you need to take that, because that happened to me, and that's completely irrelevant because everyone's unique.
Yeah.
And you start trying to, again, do number 2, which is change your dose and start doing it yourself. You just need to communicate with the doctor and
don't listen to the forum.
Yeah.
Don't, this
work
is
with the
why,
person that's looking after you.
This is why you pay the doctor, you go to see the doctor, so that they can manage your care. So that's what the doctors are there for.
Yeah. So number 5.
Have patience. It takes a while, as we've said in other videos. Have patience with your treatment. Yeah. It takes a while for the body to do what it needs to do to absorb the testosterone and to start making changes to your body. So it doesn't happen overnight, the improvements, and so you need to be patient with it. And if you are having side effects, of course, the doctor can make the course corrections that are needed. And then you have to be patient for those things to take effect. Yeah.
So on the other videos, you'll see where we go a little bit deeper. Waffle on a little bit about the other timeline of things and how it can change for people. So just because things aren't working for you, just because a symptom that really bothers you hasn't changed yet, and someone on the forums or a friend or someone has been through therapy, it happened to already and it has improved. Just have patience. It's a long game in lots of these situations, right? So I think that's a key one.
So that's it. Those are 5 top tips to how to help avoid side effects whilst you're on TRT. So if you like this video, please subscribe, because we're going to make more videos like this. And don't laugh at me, Sam. And
get it.
You do the rest.
Please like and subscribe and ring the notification bell if you want to see further content like this.
Yeah, that's it.
Yeah.
All right. Till next time.
All right. Thanks.
All right. See you next week.